women's health is an often overlooked yet increasingly important issue, as recognized by the World Health Organization. Also, according to the WHO, unsafe sex is the second most significant risk factor to health in developing countries.
We found an unmet need for the millions of women working in factories exporting products around the world. These women, often aged 18 to 25, had no access to health care and no information about how to ensure their own health.
BSR, along with the Levi Strauss Foundation, the Mary Stopes Sexual Health Organization, and clothing industry stakeholders took action. In 2007, the Health Enables Returns, or HERproject, was launched. The aim: to improve women's health throughout the supply chain in the garment industry.
We're working with companies like Levi Strauss & Company, Nordstrom, and Gap, as well as local organizations, community organizations, to educate women, to give them access to community health organizations, and to educate their employers to make sure that they can access the health care that they need, often around reproductive health.
Working for hours in a factory means employees are usually unable to visit external health centers. By setting up clinics inside the factory, dramatic results have been achieved, as Teresa Faye Bucios from the Levi Strauss Foundation explains.
There was a 43% decrease in staff turnover, employee turnover, and an 18% decrease in absenteeism. And in addition, there was a much more positive attitudes by the workers.
Research showed that for every dollar invested in women's health and training, employers were getting a $3 return in the form of higher productivity, lower absenteeism, and reduced turnover.
I think this project has great potential to be rolled out in factories all over the world. And that's really what we're looking for. We're not looking for change in a few countries. We're looking for change around the world.
It's a sentiment that is wholeheartedly endorsed by BSR, which hopes that by the end of 2008, the project will be active in 25 factories, positively impacting the health of 50,000 female workers.
We work with a lot of member companies who have factories from which they source in countries like China, India, Indonesia, Pakistan, Vietnam. We're working with Nordstrom in China in 5 factories in the southern part of the country. We have carried out an HIV/AIDS awareness raising program in these 5 factories, and initial results indicate that the level of health awareness among women workers has improved dramatically.
And once the HERproject is established within the garment industry, BSR hopes to take the lessons learned and apply them to other issues that affect factory workers, such as financial literacy and workforce development.